It was an awakening experience for me. Definitely helped me to put my priorities in order, and it was a disease that I never thought about.
I didn't believe it, you know. I never had a symptom at all until I had a colonoscopy.
I had heard of the disease, but I, like so many others, thought it was a man's disease, and my mom was diagnosed. It shocked me.
I had no symptoms. I had surgery, I had chemotherapy for a year, and it's history now.
In my family, once my mom was diagnosed, everybody went and got a colonoscopy. And ironically, my father, they found 3 cancerous polyps. They were able to remove his polyps right then and there, and he's been cancer-free ever since.
The doctors think if I'd waited six months longer, it probably would have metastasized throughout my whole body. It can happen at any age. It's not something that only hits people when they're 50.
I can't help but express my frustration when I see a patient who's 63 years old and now have a stage 2 or stage 3 colon cancer, when in fact if they'd gotten their colonoscopy at age 50, they would never have been in my office in the first place. So first you got to recognize that colon cancer gets a lot of people. 150,000 people every year are going to get colon cancer.
It's the #2 cancer killer in the country, and I don't think many people realize that.
But most of those people shouldn't get colon cancer because we can prevent it.
I think it's very important for people to be aware of this disease because it is one of the most preventable types of cancer.
Maybe 90% of the cancers begin in these tiny little growths called polyps. And polyps have no signs, no symptoms.
And the only way to prevent it is to be screened. A colonoscopy can identify a polyp, a thing before cancer, and remove it and keep you from ever getting cancer in the first place. That's better than a PSA can do for prostate cancer. That's better than a mammogram can do for breast cancer.
So the colonoscopy is the only way to examine the whole colon and remove the polyps, and for most people ending their cause of the disease right then and there.
The folks with a strong family history, if you have a first-degree relative, a mother, father, brother, sister, who's had colon cancer or polyps, then you're at higher risk and ought to be screened. But everyone out there should, by about the age of 50, get their colonoscopy.
You know, it's not your prettiest organ, but it certainly is vital, and you need to think about it and be aware and get tested, get screened.
Colonoscopy saved my life, and I'm very proud of pushing colonoscopy as a result of that.
You should know what you're dealing with, and you should know the intelligent questions to ask when you go to the doctor.
You need to be proactive. You need to start the conversation with your doctor.
And it's not the first thing that leaps to mind. Doctors aren't always responsive, especially if you're younger.
I'm here only because I had colonoscopy, but that's how it works. And if you don't look, you're never going to find it.
I was so glad I had it. That's why I still am here, I think.
The colonoscopy is so important. I mean, my mother died and my father lived because of her death, and we know the importance of this test.
Preventing the disease, colonoscopy is the key, so scope it out.
Scope it out!